I see people are joining us, so we're just going to wait a few minutes here before we start the introductions. I think it's going to be a big group tonight.
Awesome.
I resent everyone the link just half an hour ago as well, so hopefully it was nice and handy for a lot of people. Sometimes it's hard to find those old emails with the link. Okay, we're up over 100 already, so that's great. So anyway, I'd like, my name is Leslie Lampton. I'd like to welcome you on behalf of the Ridgefield Library. And I'm just going to pass over now to Karen Gordian, who is the co-founder and chair of Lyme Connection, and she will introduce our speakers this evening. So thanks, Karen.
Thank you, Leslie, and thank you to the Ridgefield Library for all your support over the years, as well as Books on the Common, who's also sponsoring this program tonight. Lyme Connection is a Ridgefield-based nonprofit organization. We founded in 2003 at the request of First Selectman Rudy Marconi. And we focus on providing patient support, education, and our blast prevention programming for the community. We also actually right now have been distributing these little kits that are filled with everything you need to prevent Lyme disease. You can pick those up at the health department, town hall, the Ridgefield Library, RVNA, as well as Books on the Common, if you decide to go in and pick up a book. We're very excited to have both Dr. Stephen Phillips and Dana Parish joining us tonight. Dr. Phillips is a Yale-trained physician with a very busy practice here in Wilton. He specializes in the treatment of tick-borne disease and has treated thousands of patients from over 20 countries since he first started his practice over 20 years ago. Dr. Phillips is one of a very elite group of extremely gifted and compassionate physicians who have helped tens of thousands of people regain their health. He has never stopped looking for answers for the complex and fragile patients that arrive in his office, and his research offers hope to people worldwide. Chart-topping singer and songwriter for Sony, Dana Parish had her life and her career derailed after developing heart failure caused by Lyme disease and Bartonella. Struggling to find a proper diagnosis and treatment, Dana thankfully found Dr. Phillips. Dana has been a powerful advocate for people struggling with tick-borne diseases ever since, and we're very lucky these two found each other. Joining forces, Ms. Parish and Dr. Phillips co-host a very popular series of interviews on Facebook, our Facebook chat, and have co-authored the book that we will be discussing tonight. Chronic, the Hidden Cause of the Autoimmune Pandemic and How to Get Healthy Again, takes a hard look at the autoimmune pandemic plaguing our country and questions the possible causes behind these diseases. They also look at different ways one might be treated in order to return a patient to health. And they teach us to question the medical doctrine that sometimes offers a cookbook approach to medicine and can sentence someone to a lifetime of symptom management rather than a return to a full and healthy life. We are very thankful for everyone joining us tonight, and I'm turning it over to Dr. Phillips and Dana Parish.
Thank you, Karen, and thank you to Lyme Connection, and thank you to the Ridgefield Library, and thank you to Books on the Common, amazing store. I'm so happy to be here with Dana to talk about our book, Chronic, the Hidden Cause of the Autoimmune Pandemic and How to Get Healthy Again. And we wrote this book because when we came together, Dana came in as a patient and we immediately clicked, and it turns out that our moms are very similar and we're like brother and sister. And we knew that there's so many people suffering with chronic and autoimmune conditions, and there's so much evidence that these conditions have a link to chronic common infections, and we had to get the information out there. So Dana, why don't you tell a little bit about your story, and we'll just go back and forth.
Sure. First of all, thank you guys so much for being here with us. And I want to thank Karen from Lyme Connection, who's been an incredible support to us, and to Ridgefield Library, Books on the Common. Very, very grateful. So in 2014, in the summer, I left my apartment in Manhattan to go to a wedding in New Jersey, and I came home with a crushing head and neck ache. Little did I know that there was a little deer tick under my bra strap that I brought back with me. And I came home with Lyme disease. A few days after my bite, I got out of the shower and saw the bite and a little rash. My flu-like illness was sort of resolving by then. But I did catch the bite within a week, and I did catch the Lyme disease within a week, and I got treated with 3 weeks of antibiotics immediately. And I was told that I was going to be completely fine. I did follow up with an infectious disease doctor after I had gone to the urgent care and gotten the 3 weeks of doxycycline. And he also said, absolutely would have given you the exact same treatment, nothing to worry about, go on with your life. So I was actually about to sign my new publishing deal with Sony Music. I was super excited. I had just written 2 songs for the new Celine Dion record, and I was about to travel the world and write and be singing, and I was really at the prime of my life. So approximately 3 months after that tick bite, and after I was told I would be fine, I woke up with my breast swollen and in extreme pain. My internist immediately sent me to an oncologist. We thought I had inflammatory breast cancer. I did not. He ruled that out. And this illness progressed, this situation progressed to extreme weakness, a tremor. I was so weak I couldn't lift a fork. I could no longer walk my dog. Severe cognitive problems, extreme anxiety, depression, insomnia. I lived in a high rise in Manhattan. I kept having these intrusive thoughts that I was going to jump out the window. I couldn't stop my thoughts. These are things that had never happened to me before. During this period, I was going from doctor to doctor. I saw about 12, so-called top New York City doctors, a lot of infectious disease doctors, internal medicine, sports medicine for my weakness. Nobody ever took seriously the fact that I had this huge, brand new multi-systemic illness, and nobody would consider that it was related to the tick bite. And when I would tell everybody, but I just had Lyme, could that do it? No, and don't Google it. And you're not going to be a crazy Lyme person, and all this stuff that I had never even heard about before. And I think really nobody took my symptoms very seriously until I couldn't breathe in December. I was extremely short of breath. And my internist sent me to get my heart checked, and I was in heart failure. So at that point, I Googled all of my symptoms, and I had 37 of 60 on the Lyme checklist that a doctor named Joe Burrascano, who's retired, a wonderful doctor, had written in some point in his career. So had 37 of the 60 symptoms. Now I'm completely non-functional. I can't breathe. I can barely walk, and I'm furious. And I don't know where to go for help. Thankfully, at that point, I put out the word to some friends. Somebody sent me to Dr. Phillips and said he was brilliant, and they thought that it would be really important to get in to see him, and he saved my life. And the injustice of all of this, and now hearing from so many of you and so many thousands of people from all over the world since this happened to me and I became public with my story, Dr. Phillips and I could not sit idly by and not bring this whole entire scandal to the world and let people know, this suffering is absolutely needless, and it's unacceptable. And so that's why we're here. Thank you, Dr. Phillips, for saving my life.
You're
really
welcome.
Appreciate that.
You're anytime.
Yeah.
So there are some take-home points from your story, because there's an expression, if you have a hammer, everything looks like a nail. If you go into a doctor who, let's say, is a rheumatologist, they would diagnose you with fibromyalgia. If you go to a cardiologist, they'll diagnose you with heart failure. Go to a psychiatrist, they would diagnose you with anxiety and new OCD. So you would have 3 chronic illness conditions, and that circles around and brings us back to the premise of the book. The book is presenting the overwhelming evidence that chronic common infections, Lyme, of course, is one that everyone has heard about, especially in Connecticut. It's a very common infection. It gets all the spotlight. And we go into that in depth. We go into the weird microbiology of this organism, the weird manifest symptoms, and the weird politics. But it's not the only one. It's far from the only one. There are so many. And And, to think about the patients that are suffering needlessly with a diagnosis of rheumatoid arthritis or heart failure or MS and all these conditions, like I said, there's such powerful data of chronic infections that can cause them. Again, not all Lyme. It's kind of heartbreaking. And, I have personal connections to this as well. Not just a doctor, I'm also a patient. Plus, my family was almost devastated by these illnesses. So some of you may, and some of you may not know that when I was doing my residency training at Yale, I was researching Lyme, the microbiology and immunology of this weird organism. And my dad had a meningitis in the 1970s that they thought was a virus. And he started having heart problems after that, which were first mild and then became progressively more severe. And the long story short is that he ended up in end-stage heart failure over a period of many years. And we took him to the best doctors in all the New York City hospitals. And he said he won't survive without a heart transplant. And at that point, I said, this is a condition called dilated cardiomyopathy. It's a type of heart failure, and Lyme can do it. So maybe he has Lyme. And the doctors scoffed at me and wouldn't check him. He said he doesn't have Bell's palsy, he doesn't have arthritis. And they went by these stereotypes that don't really, stereotypes are just like the tip of a very big iceberg. And it was up to me to treat him, and I saved him, and his heart failure completely resolved. He's 88 now. He never needed that heart transplant, and he ended up, having full heart function return. And then I think about Dana and I's good friend, the late Neil Spector. He's a professor. He was a professor at Duke University. He was a world famous oncologist, and he lost his heart to Lyme disease because his doctors weren't as familiar as they should have been with the weird chronic manifestations of what this infection can do. And I have to tell you that my personal professional experience, we've treated about 40 or 50 patients with late stage heart failure, and we've not had a single one not improve. So there are some late stage manifestations of Lyme that improve very well, like heart failure, and some of them are more stubborn. So I do think that, like I said, it's not just about my dad's story. In 2010, I was sleeping in my bed at home, and I got spider bites. And within 2 months of the spider bites, we're not really taught to think that spider bites are something that can make you sick, but I got rapidly ill. My body exploded with arthritis all over about 2 months later, and I started getting fevers and weight loss and anemia, and all of this was severe. I lost 50 pounds. I had fevers 102 every night. I went to 25 doctors. And I ended up having to give my practice for 2 years, and I didn't walk for 2 years. And I needed 24-hour home care. I couldn't turn over in bed without assistance. I couldn't lift my arms against gravity. I couldn't sit up on my own. I wasn't just disabled from my job. I was disabled from every aspect of life. And I came back from that by figuring it out in the last inning and putting the pieces together, saving my own life. And if it happened to me, with the medical education that I have and having the experience with these illnesses, and I went to 4 of the big Lyme doctors, and they couldn't figure it out either. So you say to yourself, what chance does the average person have of navigating this medical maze? And it's slim to none. So I do think that the information in this book can save a life, can save a lifestyle. No patient should be thinking that they have to suffer for decades on 17 prescription drugs, on chronic immune suppressants if there's another option. And that's why I want to get this message out there.
I think what was most surprising to me to learn throughout this journey was how much chronic illness, autoimmune illness, and psychiatric disease, and even just when I say disease, I think when people have anxiety and depression, they don't consider them, I have a disease. But even these kind of little things that maybe don't disrupt your life fully have a cause. And it is shocking to me how frequently these conditions are caused by an infection that's treatable. So instead of, for me, I was diagnosed with fibromyalgia. And as Dr. Phillips said, I was on my way to a number of others. I had MS-like symptoms. I had the tremor I mentioned, that's like a Parkinson's-like syndrome. And I had this severe overnight onset of anxiety, depression, insomnia. I was hallucinating, all kinds of stuff. My brain, my whole self was just not my own anymore. I am so lucky I saw the bite. And I'm so lucky I saw the rash because most people don't. So there's this whole misconception that I have to be a hiker. Well, we were both bitten in our sleep. So you don't have to be a hiker. I mean, it's kind of, and also hikers are the ones that are more attuned to looking for ticks because they know, they see the signs are on the trails and they know they need to look for ticks all the time. When you're walking from your suburban front door to your car, parked, in front of the mailbox, you're not thinking about ticks most of the time. And that's when, a lot of times people get bitten and they never know. And they wake up really sick. They get a flu-like thing. It resolves like mine did. And then 3, 6, 9 months later, all hell can break loose. Or as we talk about in the book, you can be the slow boiling frog. I was the runaway train where, I just got symptom after symptom. But one of the things that I thought was interesting also to learn from you, Dr. Phillips, is roving migrating symptoms are often a hallmark. So you can have this symptom or this group this day, and then they go away and you think, oh, I'm fine. I'm just a tired mom, or I'm just a stressed out executive, or I just lost my job, whatever the thing is. People are always attributing their physical symptoms to stress often. And a lot of time, like, in my case, my anxiety, depression, insomnia, hallucinations, full body weakness, pain, visual disturbances, light sensitivity, all went away with treatment. I mean, it's a big deal to know this. And I think it's the dirty little secret of medicine is that these things can be treated in a really fundamental way, and you don't have to go on psych drugs and immune suppressants for the rest of your life. I never had to take any of it.
Well, this is pulling the blanket over, the blanket away from some of these things that either doctors don't know about, or it's so dogmatic that they don't approach these options. But I also want to make it clear that ticks are not the only villain here. Bug bites of all kinds can spread various microbes that can make people chronically ill. And some of them aren't spread by bugs at all. Some can be inhaled. Some can be from eating undercooked dairy, undercooked meat or unpasteurized dairy. Some you can get just by touching soil. Who hasn't walked barefoot on a beach? You can literally get these infections anywhere on the planet. And there is this stereotype that people, it's like Lyme, 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 everybody focuses on Lyme. I'd say in the first third of the book, we're heavy into explaining Lyme, and then we branch out into the myriad other infections that could also do us harm and how they work together and what the best strategies are. I think the book provides a step-by-step guide on how to get, navigate the maze, but also a way of thinking on how to approach and unentangle these things. And the perfect, segue is COVID. Now we have COVID. Long-term COVID symptoms are a burgeoning pandemic within a pandemic. And the last chapter of the book is devoted purely to COVID and the long-term manifestations of COVID. And you say, what is causing long COVID? Nobody knows. It's this big mystery. Well, it's most likely one of 3 things. There could be some damage to the body that takes a long time to heal. The people can still have the virus that causes COVID still in their bodies. That's been shown now that it can last much longer than people realize. And the other thing that no one is talking about anywhere really, except here and among some groups of doctors, but it's not in any book that I've read, is that a bad virus can set off and have people who are, beforehand infected with these organisms, but not be sick and turn them into people who are sick. Like, people don't realize that in the Northeast, about 10% of the population is walking around having been infected with Lyme and they're not sick. So what happens if they get a super bad virus, their immune system is shot from the virus? Can you reactivate a latent infection? And before COVID came around, I was seeing tons of patients that had similar stories when they had a bad case of mono, or similar stories when they had dengue fever, and they would respond to antimicrobials directed against other reactivated infections, which were not mono and not dengue fever. So that's a definite possibility. We explore all that in the book. And we have some Q&As. So I want to just let everybody know that they can submit questions through the Q&A screen on the bottom of the screen. There's something, I guess, that pops up on the right here, and we can talk for a bit and then go over some questions that people may have. And, I think that the COVID one is they're getting kind of gaslighted and dismissed by the medical community in a similar way that what we call the Lyme Plus patients have gotten for years. We call it Lyme Plus in the book because it's easier than saying Lyme plus 15 other infections that we're looking for and evaluating in these patients.
Yeah, and I think one of the most important things that happened to us in the last year was realizing that COVID was now blowing the lid off of the entire what an infection can do to a person situation. I think it was a really largely unknown to the general public and even to the medical field. And I mean, so Dr. Phillips, how much, I mean, really, Yale trained, how much instruction did you get in medical school about the underlying causes of immune disorders, psychiatric disorders, and neurologic disorders?
We got nothing. We got zero. I mean, we had a paragraph about Lyme. The paragraph was wrong. And these autoimmune conditions was just, you're putting people in a box and the investigation stops. The answers to the question why doesn't seem to exist. So I went to 3 rheumatologists. I went to 3 of the best rheumatologists, and they were top notch. And I'm not saying that their diagnoses of rheumatoid arthritis and spondylitis, which is arthritis of the spine, were incorrect, but they don't ask the question why. And I went back to them and I said, look how I got better. Look how I got my life back. And is this going to change how you practice with your patients? They're like, we're really glad that you got better, but no. And I said,
but you got better with what? I mean,
I got better with antibiotics and antimicrobials. And you say, what do you mean by antimicrobials? Whoa, I just pulled my microphone out. I have very, very small ear canals. They usually fall out spontaneously, but this was actually my fault. I actually
this was the longest you've lasted.
Usually every 5 minutes I'm pulling this thing out. But what did I take? The medicines that worked for me were a combination of different antibiotics and non-antibiotic antimicrobials. So there are prescription medicines that are, let's say, some antifungals actually killed the Lyme bacteria and killed Bartonella, for example, in the test tube, and have published to work in some patients. Some antimalarials do the same, and some herbals. So it was, for me, I like I said, when I figured it out, I had a dedicated regimen. But in terms of the herbal regimens I tried, that was kind of hunt and peck. And when I went back to practice, I said to myself, wow, I've really figured this out. I'm going to be able to treat every severe case of Bartonella that comes in with the same stuff that I got better with. And it doesn't work that way. So you can't really cookbook this. These are emerging infectious diseases. They keep finding new species of Bartonella every week. And before AIDS, they only knew about 2 species of Bartonella. And one was trench fever, which the British got in the trenches in World War I. And the other was Bartonella bacilliformis, which is in the high Andes Mountains of South America. And if you didn't go hiking in the Andes Mountains, you couldn't possibly get it. So, and then when AIDS came along, they started noticing this weird bacteria in people because their immune systems were so bad. But if it wasn't for that, we wouldn't have known that this is a ubiquitous infection, how common it is, and why it causes some severe disease in people like, in myself, and why it causes basically no disease in others is a big mystery. But I always say I have the baldness genes and I have the not able to tolerate Bartonella genes. It's a great combo.
I have the bad Bartonella genes as well, and I didn't say that. It is kind of something to mention, which is that, yes, I had Lyme, but the other thing I got was Bartonella. So ticks can transmit many diseases in one bite. That's also something I didn't know. I thought that ticks could only give you Lyme disease. And none of the other doctors, including the 3 or 4 infectious disease doctors that I saw, even considered testing me for other tick-borne diseases, knowing that I had a bite. I had pictures of my bullseye, a well-documented case, and I couldn't get them to even give me an infectious disease panel. So that's how bad things are. And these are, again, NYU, Mount Sinai doctors in New York City. You think you're going to the best. And actually, because the training is wrong everywhere across the board, it doesn't really matter where you go unless the doctor has real special knowledge and training in this area, and most of them don't. So that's why we wrote the book. There was no book like Chronic when I got Lyme. and when I got sick and when I lost everything. So, you know, I just felt so alone and so isolated. I also couldn't find any hopeful stories, very few hopeful recovery stories. I think people leave the message boards as they get better and they don't want to revisit this. And I completely understand that. Personally, I could not leave this community knowing the suffering was not going to end. And so that was such a huge motivation for me to write the book, was just the desperation that I felt I had to pay forward the gift that I got of recovery. And so I did like 6 or 8 months over the course of a year of rotating antimicrobials and antibiotics. People always want to know what I did to get better. Under Dr. Phillips' care, I also took some Chinese herbs, and I tried to do things to calm my system, like say no to things that were stressful for me and say no to people that were toxic for me. And I was better in a bit under a year. And so, you know, very grateful for that. Dr. Phillips, I'm so interested in talking to you about, you're such an expert in the infectious causes of MS and RA. And I wondered if you wouldn't mind sharing a little bit about those and your experience in treating them and these sort of hopeless cases that actually ended up being full of hope and recovery.
Yeah, I mean, I don't think there's such a thing as a hopeless case,
Right.
but what people don't know is that there are at least 12 randomized controlled trials treating rheumatoid arthritis with antibiotics versus placebo, and the antibiotics work and the placebo doesn't. And then the critics of things like this will say, oh, the antibiotics have an anti-inflammatory effect. Some antibiotics do and some antibiotics don't. And when they've used antibiotics that don't have an anti-inflammatory effect, it still worked and the placebo didn't. And when they've compared it to patients who were not getting better on steroids and methotrexate, the antibiotic, which is like a standard treatment for rheumatoid arthritis, the antibiotic still worked when they didn't. So I think that people have to understand a few things. Number one, the anti-inflammatory effect of antibiotics is there in some, not present in others. When it is there in some, it's not really strong. Next time you sprain your ankle, try taking a doxycycline and see how well it works. It doesn't work that great. And it's small. It's like far less than an Advil. And the people with rheumatoid arthritis are chewing Advil like crazy and can't get the relief that they can get with these antimicrobial therapies. In terms of the relationship to things like Lyme and Bartonella, that's been published already in the literature. Many cases of these infections presenting with rheumatoid arthritis like symptoms. You say, the big thing is semantics. Doctors like to use the word mimic as if there is this definitive collection of rheumatoid arthritis that is not caused by infection. And I'm not saying there isn't a percentage where it's purely autoimmune, but nobody really knows everything. And all I can say is the percentage of cases where it mimics RA, or the percentage of cases where infections mimic MS, then those cases of RA and MS are caused by the infections. Then you say, how high is the rate? It's, I think, very high. My response rates to patients when I've treated them, it's 98%, and that's what it's been. You say, do we get all 98% better all the way? No, most people get like 90% better. We have about 2%, which is 1 out of 50 patients. We can't seem to budge them at all. And everybody else, we budge the needle very significantly. So that's been my experience over 25 years. So I think that these are probably very common situations where infections are at the root of chronic and autoimmune illness. And there may be cases where either there's not, they're not at the root, the cases that don't respond to treatment, or there may be infections that we have not yet discovered and don't know how to treat well. You say, how can that be? How can we not have discovered these infections? There's a study published a few years back in a major medical journal that showed that we have yet to discover 99.999% of the microbes on the planet. People always ask the question, how do you know how much you haven't discovered yet? Because they look at the genetic variability among microbial life that we know of, and they could extrapolate out in all directions to figure out how many microbes there should be based on the variability that exists already. And it's a really accurate math equation, math theory there. So it's been reproduced before. So I think that, we have to approach these things with humility and realize that there's much more that we don't know than we do know. Mm-hmm. But on the topic of MS, that wisdom goes back 100 years. They found spirochetes in the brains and spinal fluid of MS patients literally 100 years
What are
ago.
spirochetes? What are
Oh, what are
spirochetes?
spirochetes? Spirochetes are spiral-shaped bacteria, and they actually change form, and they're no longer spirals when they're in a mammal. But in a tick, for example, Lyme is a spirochete, and there's many other spirochetes. Syphilis is a spirochete, and another one is leptospirosis, is a spirochete, and leptospira. And it's just a whole big class of organisms, and they have something in common, that the part of the tail that makes them swim is very much immunologically similar to myelin, which is the coating around nerves. So when the immune system has a reaction against flagellin, which is what makes them swim, they can cross-react with the coating around nerves. So there's a perfect immunologic model for the development of demyelination, which is what MS patients get when the myelin breaks down for spirochetal infection. And they've done baby animal studies in the past where they've taken spinal fluid and brain tissue from MS patients and put them into baby animals to see what happens. And lo and behold, the animals get MS. So how much more information do we need to suspect that this is a spirochetal infection? In some cases, they actually found spirochetes in the animals after they were inoculated from MS spinal fluids. So, but you say, why aren't doctors talking about this? Is this such a crazy thing? No, these things are published in big medical journals. But I think when they discovered immune suppressants and showed how, they can quickly suppress the symptoms, medicine took a really dangerous path into kind of palliative care. Like one of the rheumatologists who wanted to put me on immune suppressant drug for the rest of my life, she held my hand and she said, "We can cure you with this drug." And I was like, "Okay, what are we treating?" And she said, "We as rheumatologists don't focus on cause, we only focus on effect." And I said, "That's not good enough. I need to know, you can't use the word cure. If you want to use the word palliation, it'll be accurate, fine, no problem. But let's be accurate with our terminology, because I wouldn't consider that a cure if I'm just going to suppress my symptoms at great risk to me. What are the risks of long-term immune suppression? I mean, obviously opportunistic infections, people can get tuberculosis and exacerbations of hepatitis B, and people can get sepsis easily. People get community-acquired pneumonias. You can get a whole bunch of brain infections. There's some fatal viral brain infections people can get from them. And what about cancers? So it's not
Right.
a treatment without significant risks to it.
I think we have to also just explain, like when you take an immune suppressant, you have to take it literally. It is suppressing your immune system. And what that does is allow these other things, so when Neil died,
Dr. Neil Spector, yep.
Yes, when Dr. Neil Spector died.
From complications from immune suppression after his heart transplant.
Yes.
May he rest in peace.
He died because he was on basically the Lyme or whatever infections, opportunistic infections that he had were able to take over his body, and he died in June. And he was trying to lower the immune suppressants. He felt they were mismanaged. He was trying to figure it out until really he died, and it was too late. But that's what can happen. And when you see these commercials and the end of the commercial, they tell you about new and worsening heart failure and cancers and all these symptoms, you have to ask yourself again, why are all these drugs related to these same horrific symptoms? And a lot of them perhaps are because infections are, when you depress your immune system, it can't fight the infections. So it's really, it's an incredible annuity for pharma to keep you on immune suppressants. It's how many billions of dollars a year do these drugs make, rather than some cheap generic antibiotics. And how much money do psych drugs make? Again, billions of dollars and
hundreds of billions of dollars.
Hundreds of billions.
So, is there any question why some sections of of the medical community do not want people to read what's in this book? Is it any wonder?
Of course, yeah. We've definitely had, we had an article the day our book was released in the New York Times about the book, and it was a really fabulous and glowing, supportive article, because this really ties into long COVID, and we will get into that. I know some of you were asking questions about how to help.
Why don't we go through some of the questions?
Yeah.
And I just want to acknowledge some of the people who said such nice things. We'll just go down the list. I don't know how this list is populated, but first come, first serve, or
we have,
can
I throw
how about you want to take one? I'll take one. We'll just switch off.
Sure.
Okay.
Well, first of all, there's Brandy Dean, who is a dear friend and founder of Harvard's Dean Center for Tick-Borne Illness, and she's a hero. And
Hi, Brandy.
We love you so much, Brandy. And
Hope you're well.
we need to talk about, her question is really important. If you have severe neuropsych symptoms, should you be treated with antibiotics along with antidepressants? My answer is sure, if you need to. I mean, what would you say?
Well, she's asking if she should be treated antidepressants along with antibiotics. I mean, you have to
Right.
keep people safe and not have them suffer. So if somebody is having severe psychiatric symptoms and they're, number one, a danger to themselves, a danger to others, or they're just suffering, of course you should ease their suffering and keep everybody safe. So the answer is absolutely yes. And so it's a matter of degree. I am not against symptom control. And people have come in, let's say, when people have come in on immunosuppressants for many years, when they have a diagnosis of RA or another type of arthritic syndrome or MS, I don't actually go and tell them, go off immunosuppressants and do this. I say, look, we can try to add some antimicrobial therapy if we find an infection that's reasonably going to be at the root of your illness. And we can see if you start to improve with these treatments. And if you do, and if you want to titrate off the other immune suppressive treatments, people know, like when the psych symptoms go away, they naturally want to go off antidepressants because they don't need them. When people have attentional problems, it's so suspicious when an adult, let's say a 38, I've had this in my practice too many times to count, where someone in their late 30s who's gone to, let's say, a great business school or is an attorney or something, and never had an attention problem in their life, and all of a sudden gets achy all over and can't concentrate and gets diagnosed with adult onset ADD and now is on Ritalin or Adderall. And you have to say, okay, this is not a genetic ADD, this is an acquired ADD, and infections can do that as well. And those people they just know they just naturally don't need the Adderall anymore, and they titrate off as we get them better. So.
Okay. Do your protocols include IV ozone MAH?
They do not. First of all, we don't use IV anything in my office, and we don't use IV antibiotics because the studies for Lyme actually don't show them to be superior to oral medications. And I don't use ozone because like I said, I'm a patient too. I can't prescribe anything that I personally don't feel comfortable with and would be nervous about. And ozone has the ability to have some, genotoxicity to it, which means it can damage DNA. So I'm always scared of anything that could possibly damage DNA. Could it lead to cancer? Again, there are a lot of people that are proponents of ozone in the alternative medicine community. I'm not an alternative medicine doctor. I have a healthy respect for alternative medicine because I've gotten benefit from herbals. We have some herbs in the office, but I keep all these things on a very short leash. Like, I don't want to ever be like, I've spent $5,000 on herbs when I was trying to get well. I went to 25 doctors, including functional medicine, and I would take, the Lyme doctors would tell me to take antibiotics. And I would say it's not working. I feel crappy. And then they say, do it another 2 months. Not working. There was nothing that was a short leash. It was a very long leash, and same with the herbs. And I figure like this, if the herbals aren't making any impact in 2 to 4 weeks, I cut them short. There's a lot of options out there, and I wouldn't want people to waste their time on medications, herbals, or anything that's not helping them.
Okay. Wow, we have 48 questions. So let's,
Sure.
all right. Do you recommend okay, this is a very common question. I don't know we have an answer, but I'll ask it anyway. Do you recommend COVID for somebody who has had Lyme?
COVID vaccines, you mean?
COVID vaccine, sorry, yeah.
Right. So, I want the vaccines to be effective and safe and all these good things. The fact is these RNA vaccine technologies are quite new. Most people are doing okay with it, but we are hearing some reports of severe side effects, and there have been some deaths, associated with it. Having said that, both my elderly parents have had both shots of the COVID vaccines. I'm not telling my patients not to get them, but I have had some reports from my patients of very severe symptoms. One patient absolutely will not get the second shot because it did flare up his illness so horribly. So I just tell it like it is. I don't pull my punches. I'm not, I don't put, tiptoe around. I don't eggshells. I do think that COVID is a scourge. It's a beast, and we want to control it in any, effective and safe manner. I would love for these vaccines to have been tested longer and not be so rushed like they are, but we were in a tough spot and it's a very uncomfortable situation. So I'm neutral on the vaccines until we get more information. And I want everybody to know that there are other vaccines coming down the pike that are more traditional. There's the Novavax vaccine, which is probably like 6 months away, and that's based on a very, very old school vaccine technology. We'll
Mhm.
see how that does as well.
Okay. Is IVIG something that can help somebody with Bartonella and Mycoplasma pneumonia?
So it's usually, in my experience, it's usually not so much infection specific as it is presentation specific. Like, so for PANS also, some people call it PANDAS, but the new terminology is PANS, is pediatric acute onset neuropsychiatric syndrome. For
Mhm.
that group, IVIG seems to work pretty well for lots of them. For people with movement disorders, I've seen it work the best. So for myoclonus, which is like shaking like this, it almost looks like someone have a seizure, but they're fully conscious. IVIG works very well for that. And even though it's indicated a lot of times for small fiber neuropathy, it's an underwhelming response. So it really depends, I think, about the condition, not the infection, because yeah, that's what I've seen. So I would need more information to comment, but so potentially is the answer.
Okay, I have a question from Patty Silver. I was diagnosed with lupus through diet. I was able to get off my meds for a few years, but I'm now back on. She also had COVID, can't smell, is
Oh no.
experiencing brain fog, and wanted to know if you can offer any help. Her rheumatologist just throws medications at her, which of course is to be expected.
Yeah, I mean, it's hard because a lot of these things do boil down to trial and error, and patients get the impression that the doctors just throw medicines at them. The question is, are the medicines being thrown at patients getting at the effect or the cause? I'm not a fan of Band-Aids. When I was in extreme pain, I did have a pain management doctor because I could not take the suffering anymore. And so I did take medications for pain. And as soon as the pain became bearable, I went off them completely. And I have a whole nightstand full of narcotics that are over 10 years old. So it's like with anything else, I do think a better strategy is always to go after the cause rather than the effect. And in people with lupus, I've treated scores and scores of patients with lupus over the years, and people should know that hydroxychloroquine, Plaquenil, which is one of the mainstays of lupus treatment, it's an antimicrobial that kills Lyme bacteria directly in the test tube. It's been published to work for Bartonella in some very hardcore, case reports out of South Korea, and it's a standard treatment for Coxiella, Q fever. So you say, well, you're saying that some of these infections could be at the root of lupus. I'm saying that this deserves investigation. Like when people come with a label, I look for the cause of the label. I can't stand labels because when you use the word lupus, it's just one word to now encapsulate 20 symptoms and let's say 4 blood test findings. And that doesn't bring you any closer to an answer of what to do. And I would like to say it's as easy, we can just cookbook it, but you can't. I have people that I call disease twins, where they'll come in with the exact same symptoms, signs, presentations, and I would think, wow, these people are going to respond to the exact same treatment, and they don't. So we have to really individualize care, which makes it very uncomfortable for doctors. And in my practice, we have it's kind of a different way of practicing. We take more time with the patients and we try to get to the root of it. So.
Are there any new treatments for Bartonella? My son has tried all the protocols and is still struggling. That question is from George.
So, yeah, I think, well, not per se, but I think that some things for Bartonella, so the disease that got me was Bartonella, and like people say, I didn't walk for years. When I finally started walking, I was on a stereotypical treatment. I was on doxyrifampin and Bactrim, and then I got allergic to rifampin and I switched to Levaquin. I was on that for 3 years. I was on hardcore antibiotics. And I was able to walk and do things and be relatively well, and I was overjoyed. And I went off them for 1 day or 2 days, and I couldn't walk. And I was devastated that I could not believe it was such hardcore 3 antibiotics all at once. And a couple of days later, I'm back almost to square one. And then I just started pulsing those very same antibiotics. I didn't do rifampin because you can't pulse that, and I was allergic anyway.
Can you
But I
describe
did.
pulsing?
Pulsing is cyclical antibiotics in order to confuse the bacteria left over. So you can use the same antibiotic sometimes in different ways and get a superior result. So I used to treat like the other doctors that treat Lyme a long time ago. I opened in '96, so I've been doing this for a long time. I've treated over 20,000 patients. And I I used to treat straight through with antibiotics. And back then I wasn't a believer in herbs, and patients used to criticize me all the time as being like the too right wing. But, and I hate to think that I was influenced by where I did my training, but Yale's a very kind of buttoned up place, and I wasn't taught anything about herbs. And I really thought they were just a ripoff. But then when I got sick, all your biases just fall away. People would come over looking for the coffee at my house, and all they see is like shells of herbs because it's up at 4 a.m. ordering herbs. And I tried every herb out there, and I found a few to really, really help me dramatically. And some of them helped me more than the antibiotics. And it was shocking to me. And I said, so this is what it's like. This is what people really talk about when they are real big believers in herbs. So I think that the people that do the best open themselves up to options that are, judicious, we use relatively safe options. The risk benefit equation is very much skewed in favor of treatment rather than in favor of not, because we use so many non-antibiotic antimicrobials. The risk to the microbiome is very low. We see almost no C. diff colitis, which Clostridium difficile colitis is a bad, abnormal flora condition which can cause diarrhea. And in the last 8 years since I've been back in practice, I think we've seen 2 or 3 cases, and they were all very special cases that had high risks for it going in.
Okay, so Jake has a question. It seems like COVID is leaving behind very similar symptoms to babesia and parasites in regards to autonomic nervous system damage and POTS. Do you think there's a lot of activation of babesia, intestinal parasites, or is it just COVID damaging in the same way?
The autonomic nervous system. Yeah. I think it could be. So long COVID patients are now calling my office, and I haven't yet decided how to handle this, because just in the press that we've done for the book, we wrote the COVID chapter. We're getting a lot of people who are interested, and I'll have to start, getting some experience in that, because I want to try to help these people. And it's, each person is a puzzle. I think that yes, like I said before, some of these latent infections can be activated and or reactivated. And I have seen patients, with COVID who have then said that they've gotten their vector-borne illness has become reactivated, and people who had previously had experience with it, and they knew. Fortunately, these haven't been my patients. Patients have contacted me and said, that's my story. Like they had Lyme with another doctor. You say, why haven't my patients had that experience? I've treated my early COVID patients early with medicines. When the first data started coming out on hydroxychloroquine, I was offering them that, and then that blew up and got super controversial, but I do think it helped a bit. And then I've been offering folks ivermectin, and now ivermectin is turning out to be the most versatile treatment for COVID. There's something like 20 randomized controlled trials now showing that it works. And the WHO sponsored a meta-analysis of 13 of them, and the overall reduction in mortality is 83%. And it's, it's a really useful treatment. So, and Jake, to sum up my answer to your question, I think there can be reactivation of these infections, but the flip side is that the COVID virus, SARS-CoV-2, could be damaging the autonomic nervous system itself, because the mechanism of pathology is a small vessel disease, and that's what usually happens with POTS type stuff.
Okay. What about Crohn's disease? Somebody wants to know if we talk about Crohn's disease in the book.
Yes, we have a whole, quite a bit actually. We talk about the various things. People don't realize that there's a bacteria called Mycobacteria paratuberculosis that's been associated with Crohn's. I brought this up to so many GI doctors, and they just roll their eyes. I'm like, isn't anybody looking for a cause? We have a panel that we do, a template in the office of the various, infections we look for, inflammation of a part of the GI tract that's known to be inflamed with Crohn's, and Mycobacteria is one of them. I see it in Bartonella patients also. You say, how can you see the exact same presentation with various infections? I think the body has only so many ways to produce inflammation, and
Right.
there's so many infections out there that can produce the similar things. And one of the examples I always use is of a patient who was on the waiting list to see me, and she has a specific type of rash that can be caused by Lyme and Bartonella, and it's well known. It's called erythema nodosum. And then she canceled her appointment because it turned out that she had tuberculosis. They biopsied the rash, and the TB took a while to grow, and they grew TB out of it. So it was.
Okay. So what about narcolepsy and cataplexy? Have you treated patients with Lyme and Bartonella with these syndromes, and did treatment minimize their symptoms so that they could be functioning again?
Yeah, I have. Yep, I have done that. So I've seen that, this is before I had my own personal experience with Bartonella, most of the patients that have experience with it. And it was part of this, some of these patients have it as a collection of I've seen it with co-localized with PANS. I've seen it co-localized with tic disorders, which are sometimes with PANS. I've seen it with movement disorders that are not always with PANS. I see them in adults too, but I've seen some kids develop, hardcore movement disorders when they have PANS also. PANS can be a very, very tricky disease to treat. It can be very, very brittle, meaning that the flares that the kids go through when they go through antimicrobial treatment can be extreme and terrifying and sometimes very difficult to control. But I've definitely had the majority of patients have gotten well, even with these very complex cases.
That's amazing. Okay, do you have advice? I guess we could both give this advice in helping educate medical caregivers who won't deviate from the CDC guidelines, even though they're wrong. I mean, this is always a really difficult situation. Doctors are not educated. I mean, what we recommend often is to bring other guidelines. So there are the ILADS guidelines for treating Lyme disease, ilads.org, in International Lyme and Associated Diseases Society. Sometimes doctors will look at data, and sometimes we have about, 1,000 studies in our book. And the reason why is because we want you to be able to bring this information to your doctor. There is like a treatment section you can even bring to your doctor because they can write these meds for you. And also, I should mention, we should do herbs also under a doctor's care because they can be really powerful. So just don't want to forget to say that I did herbs under a doctor's care too. But in terms of helping doctors to see the light, I mean, for me, the most helpful thing has been since I got better, I bring stuff in to educate them. I bring in studies. I ask Dr. Phillips for things before I go into my appointments. Sometimes I print them out. And I have had curiosity from several of them who didn't really believe in this before and really didn't think this was real. It's such a scandal that doctors are gaslighted out of even reading, like doing a literature search. I also would recommend that people bring an advocate with them, bring a loved one with you to your doctor appointments to ask questions and to keep asking, why do you think this is happening? Write down different information that you get, and what else can we recommend for people? It is such a frustrating situation and terrible situation.
I think that it's going to be doctor specific. I mean, if a doctor doesn't deviate from CDC guidelines, that may be because that person is a very rigid personality type, and no matter how much educational materials you bring in, it won't change anything. It's a very difficult situation. I do think that it's a team effort. It takes a village, and you should have doctors that are very motivated and very much on your side and are willing to dig in and do the research. And if you don't have that, you should probably move on, because you want to have a support network, because that's how people get well. It's not by doctors where you're just a number, and they have 5 more people waiting in the waiting room and they want to get out in 5 minutes. That won't work out. Having said that, I do think that medical education needs to change, and people don't realize that the pharmaceutical companies really influence all aspects of medical education. And there's a profit motive in how that education is delivered and what the message is. And there's like a top-down message that needs to change too. And like Elizabeth, your question speaks to educating from like the more the bottom up, but the doctors, if they're getting, if they start to get CME that says, wait a second, there could be an infectious cause of chronic and autoimmune disease, they're going to believe it. And that's the question. How do you access that? So let's get the next question from Janet Gemma. Hi. So she says, hi, and thanks for doing this. My brother was an environmental scientist, multiple tick attachments, Graves' disease, mental illness, now diagnosed with dementia. Any way to tell if the dementia is from long-term TBD, tick-borne disease, or does he need to be treated with antibiotics to determine he has poor disabled Medicaid, Medicare? Obviously a complex situation. And just like I said, with all these questions, I can't give specific medical advice, just the disclaimer. All of these things are in general, answers related to general topics. But my dad has dementia now. He's got Lewy body. And about, 13 years ago, he began, and he was given about 5 years to live, and he's still alive. But so I think the stuff that I was given him has slowed it down, but I still wasn't able to prevent it. So dementia is actually a topic that I take very, very seriously, and it's close to my heart. And we cover that extensively in the book. So antibiotics, once dementia has set in, don't tend to work all that well for the majority of cases. Have I seen people with significant dementia where they've reversed? I actually have, but it's a minority. So you say, what are strategies that can augment the response to antimicrobials if you find an infectious link? I mean, there are clearly infectious links to dementia, and there are also environmental links. So we call it the blood biome in the book. So people talk about the microbiome in the GI tract, and like that's the only place that we have a normal flora. And it's really not true. There's this myth that the internal parts of our bodies are sterile, and they're not. And in Harvard, they're calling it the brain biome. They're finding so many microbes in the brains of normal people when they die and they look at their brains that it's almost like its own microbiome. And then they find a disturbed and altered microbiome in patients brains of patients with Alzheimer's. And the things that they're finding preferentially in those people's brains are spirochetes, spirochetal, infections, and herpes simplex viruses. So people don't realize that there's a big relationship and a big demonstrated now cause and effect relationship between, the humble cold sore virus and actually Alzheimer's. And they've shown it in a cell culture model of a brain where they had clumps of cells and a primitive, brain setup, and showed how herpes simplex induces the changes that you see in Alzheimer's. So amyloid, which is the aberrant protein in Alzheimer's, is actually an antimicrobial peptide. It's there to stop infections from spreading through the brain. That's why we have it. Because you would think to yourself, why would Mother Nature give us the ability to make amyloid? It clogs up the system. It's not good. Yeah, but it protects, like if you give a mouse an infection with salmonella in their brain, they published this at Harvard in 2016. They find that the amyloid stops the infection from spreading and the mouse lives. So what's protective in youth doesn't have to be protective in old age. It's just how evolution works. Like once we're old enough to have babies, evolution doesn't really give a crap about us anymore. And that's how it is. And it's the same thing with like Parkinson's. That aberrant protein protects against viral infections rather than bacterial. So that's called alpha-synuclein. And then frontotemporal dementia has its own aberrant protein called TDP43, which is the same one that's in ALS. And that's a spectrum illness. So these are complex topics, I know, and it's hard to address them. So it's really hard to answer that question, and not knowing anything else about your brother. But in my dad's case, he had also inhaled volatile hydrocarbons, very toxic fumes as part of his job. He's a physicist working on secret projects for the government. And his lab always smelled like the most toxic thing in the world. And, he had a fume hood that he never turned on. And then I looked up the chemical when he started getting sick, and it's well known to cause Parkinson's. So you imagine learning that after it's like basically too late. So that's what happened there.
Can we talk about the Lyme testing? So people have a lot of questions about Lyme tests. What if you only test positive for 2 bands rather than 5? The CDC has different requirements than China. I mean, what what can you say about the inaccuracy of the Lyme tests?
That's a whole hour of conversation. But the CDC states that their epidemiologic surveillance criteria does not capture 90% of Lyme cases. So what does that tell you? Why do they have this criteria? It was initially made to have just reporting to the CDC, and it's an overly strict criteria that most people with Lyme don't meet. And some labs and some medical societies have adopted it as a diagnostic criteria, but is that correct? And I would say no, that it's not correct. And people have to know what the numbers mean. Each of these numbers, these bands, they represent specific proteins on the surface of the organism. And some of them, like band 41 are very common with Lyme, but they're also common in people who are healthy because they can cross-react with like bacteria in the mouth. But some bands like band 23, it's more than 99% specific for just Lyme. So it's important for doctors to know what the bands mean and how much specificity is involved. But the average Lyme patient doesn't have full CDC positive. It's very common in Lyme arthritis, the stereotype where the big swollen knee. Those people tend to have very, very positive Lyme tests. But with neurologic manifestations and kind of like fibromyalgia manifestations, not so much.
What do we do? What do we say about, one thing that I don't think we really talked about is post-treatment Lyme disease syndrome. This whole notion of there being this mysterious syndrome that comes on after you do 2 to 4 weeks of antibiotics after you contract Lyme disease. And I think we need to actually clarify that this is a misnomer, that this is not the right phrase to be calling those symptoms after you get Lyme. I mean, our position is that you have most likely, if you still have the same ongoing symptoms, you have an ongoing infection. I think people don't appreciate how chronic. What is the data? Dr. Phillips, it's like 61% of people after early treatment go on to get, according to Danbury Hospital, continue to have symptoms, and Hopkins says.
Yeah, we'll go into the data, but I wouldn't miss the forest for the trees though either, only because, if you talk to your plumber about this and say you have symptoms 1 through 15, you get treated with 3 weeks of doxy, and then you feel good for a little bit, and then symptoms 1 through 15 come back. What would your plumber say? I mean, your plumber would say, oh, wow, that infection came back. But a doctor would say, now you have a post-infectious syndrome. And to make up a second disease with the exact same symptoms as the first disease is such lunacy that you say, doctors are educated people. How does this catch on? Like there is this groupthink, mentality that it's so powerful. I think people have to realize what a powerful mechanism bias is and how most of us want to be part of a large group. I personally don't care. I think I have a personality disorder because I question everything. But I think that I think common sense should rule the day. But if we just step away from common sense and look at the data, it's the failure rates for early treatment of Lyme rashes, it's really high. There are many, many studies showing in the mid-20s, and Danbury Hospitals is the highest I've seen at 61%, where the people had the same symptoms, 6 months out. And then Johns Hopkins, like you said, had 39% the same symptoms. Mm-hmm. So some people choose to call it post-treatment Lyme disease syndrome, and I think that it's still Lyme. And then you say, what does the actual data show in terms of persistent infection? It's very hard to isolate spirochetes. That's one of the big mysteries, and that's why these diseases get so controversial, that they tend to be caused by fastidious organisms, which means that they're really, really hard to culture. Like they've been trying to grow syphilis bacteria from the blood of patients with syphilis for 100 years, and it's really never been done. So with Lyme, because it's also a spirochete, it's not as hard to grow as syphilis, but it's pretty darn hard. And there are about 70 human cases now where they've isolated Lyme bacteria from patients' different, fluids and organs after months to even years of antibiotics. So if you isolate a Lyme bacteria alive from a human being after 2 years of antibiotics, a year of which is Ivig, which has been published, like how can you say that chronic Lyme doesn't exist? And then the maraschino cherry on top of everything is that they've now shown in the last 5 years, multiple different studies, including Tulane and Northeastern and Johns Hopkins, have shown this data that they can't kill the Lyme bacteria in the test tube with the same antibiotics that are purported to kill it in the body. Right. So this is not a science issue at this point. Again, Lyme gets all the spotlight. I get it. It's been around for a long time. People have argued about it for a long time. I think it's so silly. Like it's a human rights issue. Nobody should be accepting this party line that Lyme is easy to diagnose and easy to cure. There is so much data showing that it's not, that it's laughable. It really is. If it wasn't so tragic and if it wasn't so serious, it would be almost like a big joke.
Do you think that COVID is going to bring to light the truth about, Lyme and other vector-borne diseases into the mainstream medical consciousness?
I do. I do. I really do think so, actually. If there's a one bright spot of this horrible tragedy, I think that, because they're already starting to put long COVID patients into this post-COVID, category, and it's just sealing that box and putting the nails on the coffin. It's like, we're not going to investigate this. We're going to give you an immune suppressant now for the rest of your life, or things like that. And I do. I think it's going to cause a public uproar because it's so visible. Lyme patients have been suffering and largely in silence for, they've been trying, but they've been outgunned for a long time. And I think a lot of these chronic illness groups will start mobilizing together, and it should be like a big change.
Yeah, so there's so many questions about how we can train more doctors. Are doctors being trained in medical school now? Unfortunately, I think that they're not still. I mean, what do you think? We have a lot of physician friends, but most of them are not brand new doctors.
No, yeah, I'm not sure what they're teaching in med school now, but I don't think that it's anything about what's in this book. I think that it needs to change, though. I think that doctors learn the most when they're in med school, and the most of their learning stops after med school and residency. I think, it's that saying about old dog, new tricks is really true. Especially, doctors they go two ways. Either they realize and they get humbled by the enormity of what we don't know, and they become more open-minded and more just, great doctors, or they go completely the other way and they just get more closed off and sometimes a bit arrogant and not great to deal with. So I think I've met some doctors who are extremely special and just wonderful and the best people around, and some nurses. And I've met some that I wouldn't want to spend more than 30 seconds with, and I just want to get away. So I would advise people that, for patients, that you're the final arbiter of your healthcare. It's not a doctor. A doctor can give you advice and tell you what he or she thinks is the best course of action, but you make the decisions and you actually hold the power. So you need to find a doctor that you click with, a doctor who's smart, and a doctor who's got empathy, and who will have your back.
Can we talk about psoriasis as an autoimmune disease,
Yeah,
and
sure.
as an infectious cause?
Right. So, well, my condition was spondylitis is associated with psoriasis. So there's a big link with Bartonella and psoriasis. I've seen it for years. So there's a published study of psoriatic arthritis where they responded to ceftriaxone, which is an IV antibiotic, and not placebo. There are studies with psoriasis responding to rifampin and Bactrim and all these antibiotics that work for Bartonella. I never forget a patient. I've told his story before, and he's a really, really nice guy. I remember him so clearly, but it was so weird because he had this history of really bad psoriasis for many years, like 20 years.
Mhm.
And he had what we thought was just Lyme symptoms for about, let's say, a year. I treated him for the different Lyme symptoms, and I got him a lot better with Lyme, and his psoriasis never budged. I figured, it's just a different autoimmune thing. And back then I wasn't putting everything together. You learn it I learned from my patients, because the books don't have this information. So in the practice, you learn if you keep your eyes open. So I put him on Bactrim, which is a common antibiotic, as one of his treatments, and his severe psoriasis, which was all over his body, just started to melt away and was gone. And when I said, and then I was like, put on my Columbo hat and tried to investigate, like, when did the psoriasis start? The psoriasis started 2 weeks after they had a family reunion. And the family reunion was out in a cabin in the woods or something. They were hunting deer. It was a deer hunting family reunion, and his job was to prep the deer, and I'm sure he got exposed to various little bugs doing that. And that's when it all started for him. Shortly after that. So
That's
a
pretty
great story.
compelling story.
Yeah.
And we have others in the book. Actually, we talk about psoriasis quite a bit in the book. So can a wheelchair-bound, and I think this is a great question, an important question, can a wheelchair-bound MS patient be helped? They were never tested for Lyme, but had, quote, MS for 20 years. That's from Kristen.
Yeah, it depends on, the answer is yes. I mean, can is a big question, it's like never, there's no such thing as, so I've definitely had patients come out of wheelchairs with diagnoses of MS and other conditions. But what makes it very important is to see what level of damage there is. So sometimes Like I had a patient with MS come in a long time ago, and his whole spinal cord was atrophied. He had so many lesions on the spinal cord, and there wasn't a way for antibiotics to fix that at that point. And when we gave him any type of treatment, and other doctors had tried before me, any type of antimicrobial at all, he would flare up to the point that he couldn't even support his torso, and his torso would fall over in the wheelchair. And I didn't think that, so some cases are very, very far gone. There's always hope. But in people like that, we would need therapies that we don't yet have, like therapies that can remyelinate, very efficiently, which we don't really have those therapies. There are some drugs that they're studying. One of them is ivermectin, for example. It's being studied as a drug that can remyelinate. So I started using it in some MS patients a while back, and they flare up on it shockingly severely. And you say, why are people flaring up on ivermectin? It's an antiparasitic. It works for COVID. What's the deal with ivermectin? Ivermectin is a very, very cool drug. It won the Nobel Prize in 2015, I believe. And it has a ton of effects on the body. And one of the effects is it normalizes the immune system. So if the immune system is suppressed, it brings it up to normal. If it's inflamed, it brings it down to normal. And if people have an infection in their spinal cord and in their brain, and that infection is a bit immune suppressive at the same time, it causes abnormal inflammation. If you normalize the immune response, you can actually make the symptoms worse. So when I was getting very, very sick and I was closing my practice in June 2011, a doctor said to me, "Want to try ivermectin?" And I said, "Sure, I'll try anything." And he gave me a high dose of ivermectin, and 4 days into it, I had to be carried out of my office and I was put to bed. And I was all happy thinking it was a Herxheimer reaction, but 4 months later, I didn't get better and I gave up, really defeated. And then fast forward a year and a half of abject suffering and multiple near-death experiences. And then I took ivermectin again, and I had no Herxheimer, no flare, no nothing. And I felt fantastic on it. It didn't even seem like the same drug. So I think that things that improve the immune response, if people have a large infectious disease burden, can make the symptoms of these illnesses worse. Because again, think of them, we're looking at what some doctors view as just the effect, the immunologic effect, and I'm viewing at the cause, but I can't, it's a dance between the immune system and the infection. So if you give something that stimulates and makes the immune system stronger too early on, when there's a lot of bugs running around, you can actually make people's symptoms a lot worse. And if you give that same drug later on, when they're much ahead of the 8 ball, then you can make them feel a lot better.
Okay. A lot of people have asked if this will be, this recording will go someplace after this. It will be on the Ridgefield Library YouTube channel. So I just want to say that because some people seem concerned that they can't show this to people that they feel need to see it. Can we, well, first of all, you mentioned Herxheimer, but I don't think we actually explain, we want to explain some of the basics because I think some people are new to the subject completely.
Right, that's true.
A Herxheimer reaction is a really important thing to explain and to describe briefly. I had it, and a lot of people, most people seem to, which when you start treatment for Lyme and a couple of other infections, you can elaborate on that, you get worse before you get better. So you can get like a flare of symptoms, this inflammatory response where you actually feel worse. And in my case, you just like panic, oh my God, what did I do to myself? And that is a very normal response to treatment when you're treating Lyme, and you hopefully, most people do settle down and get better. And for me, it was like, 1 step forward, 2 steps back for a couple of months until things stabilized and I stopped having that reaction. Do you want to comment a little bit more about, just briefly why that happens? And
yeah, I mean, there's an oversimplification of Herxheimer's. People describe it as a die-off. In my case, I flared up on medications, and then I go back to the doctor a month later, and I'd still be horrible. And then they'd say, "Congratulations, you haven't Herxheimer, continue." And then a month later, "Congratulations, you haven't Herxheimer." 4 months into it, I put my foot down. How many bacteria can I have in me to keep dying for 4 months and I'm no better? It doesn't make sense. So the oversimplification of a die-off, it's not exactly true for everybody. So there's something called blebbing, where the bacteria shed in response to stress. This is known to happen with Lyme and Bartonella, and there are many other infections that are spirochetes that cause Herxheimer's, and there are some non-spirochetal infections that also cause Herxheimer's, like Coxiella causes Herxheimer. So a few can cause Herxheimer's. Some parasitic infections cause Herxheimer-like reactions called Mazzotti reactions. But with getting back to blebbing, it's just If you have a antimicrobial resistant infection, it can just shed in response to the antibiotic stress, but not be killed. And that's what happened. My case was exceptionally difficult to treat. It's very ironic that I had such a miserable case, but all I did was flare up and it didn't get better. And I went to the rheumatologist, one of the rheumatologists I said that to, I said, it's so weird, I take these antibiotics, they make my joints swell up like balloons. They make my CRP skyrocket, which is an inflammation, marker. And they make me feel horrible. Everything is worse and nothing gets better. She's like, yes, Steve, that's called not working. And I was like, it's not as simple as that. The fact that these have an impact means that we're pissing them off in some way, but I'm not getting to the other side. And it takes sometimes innovative strategies and a change in therapy to get past those. But I want to just tell people who may have had that same experience, been being confused by it, because the doctors scratch their heads. They're like, why aren't your Herxheimer's going away? Like when I would report these long flares.
Yeah.
And we have something in the book I call the fair shake and the expiration date. Like you want to give treatments long enough for them to work and not long enough that you're beating your head against the wall and you're not getting better. Because at 4 months, when I put my foot down, the doctors they were encouraging me to continue. And they were encouraging me to continue longer on the same drugs that weren't helping. And I think that's a very, very poor strategy. And I would not encourage that. I think that if you're on that road, like how long will it take? Will it is slow boat to China? I mean, what's it take 10 years at that rate to get to the other side of it? You may never get to the other side of it. I think it pays to go for another therapy that's going to be quicker and more effective if you're flaring up for 4 months.
Steroids and tick-borne diseases. It's an important question.
Right. So it's a relative contraindication. There are some times that steroids are absolutely necessary for other conditions. So it's not like patients that have vector-borne disease can't take steroids. We have to, sometimes they're life-saving. We have to be judicious in everything that we do. And but they tend to worsen the outcomes with Lyme. Certainly that's been published. They worsen the outcomes with Bell's palsy, which is even an early, stage of Lyme. And people have to know that. So I always tell my patients, if they absolutely need to take steroids for some reason, we can pick up the pieces. I think that unopposed steroids are much more dangerous than opposed steroids, meaning steroids with antimicrobials have better outcomes than just taking steroids on their own.
Okay. What about, okay, so this is actually really important. This is a message sent in from Rebecca. She said, my son was diagnosed with neurologic Lyme after 3 years of behavioral issues, including OCD, ADHD, and suicidality at 5 years old. All of these symptoms resolve within 3 days of taking antibiotics. So, I mean, you're not alone in that. Actually, I'm glad that you said it because that happened to me too. So important to know the link. I know it's just an estimate, but what percentage of current escalation in mental health issues in young adults do you guess may be related to autoimmune problems? And I think my personal question to expound upon that is, what percentage do you think are related to infections?
Yeah, it's hard to say. I can tell you that it's now well recognized that there's inflammation in association with mental health issues. They've documented it across the board with all the various psychiatric diagnoses. Mm-hmm. And historically, and all this medical wisdom that we've accumulated over the last 100 years, and doctors quickly discard it. Infections have always been the most common cause of inflammation, period. Mm-hmm. And we see inflammation, then you hear, oh, inflammation is causing disease. Granted, what's causing the inflammation? Like right. The most obvious questions are not being asked. It's so frustrating. So they have done studies with, various infections that can cause mental health issues, from things like toxoplasmosis and toxocariasis, which are both parasitic infections, to Lyme, obviously, and Bartonella, obviously. They've done studies of people inpatient in psychiatric hospitals and shown that the rates of Lyme antibody tests being positive are almost double than the control group outside the psychiatric hospital. Why is that happening? And the same, like I said, is they have similar data for people with that get evaluated for these various parasitic infections, which are very easy to get, by the way. People have to realize also that in the United States and in med school, we learned about parasitic infections, but we were told like not to worry, and unless somebody had AIDS, the parasitic infections that we have here weren't very bad, because we know the AIDS patients used to have horrible problems with toxoplasmosis and such. But it's more complicated than that. I like to make things as simple as possible, but you can't make them simpler than they are. So there's a relationship between parasitic infections and bacterial infections, and they kind of fight against each other. The immune response against the parasite is the opposite of what the immune response should be for a bacteria. And there's studies written on this complex interrelationship where showing that, like for let's say a parasitic infection in conjunction with tuberculosis, there is data that you can't get over the TB so easily until you treat the parasitic infection, because the parasitic infection is a bit immune suppressive. Who would think, So, somebody doesn't, let's say, have symptoms of toxo, but they've been exposed and they test positive and they have it in their body. There's a reason to consider its treatment. There's a reason to consider treatment for toxocara infection.
Okay.
And,
That's important to know. Okay, so we only have a couple of minutes left, so I think we should go back to talk about the book and wrap this up, because I'm getting the, what happens when you're on TV? They start flashing the light on you.
Yeah. And I'm sorry that I'm speaking fast. We're trying to get through these questions, and there are just so many.
Yeah, we'll be back to do more. I mean, we're gonna probably do a Facebook Live on Sunday night, and
that'd be great.
We'd be happy to answer more questions. I'm sorry we don't have time to answer everything tonight. Before we wrap up, a few more words about the book. I think it's important that you know that we did a whole trauma chapter called Mending Your Mind. And the reason that we did that is because every single person that has a chronic illness goes through a very traumatic experience for the most part. We all do. And a lot of times prior traumas can complicate physical symptoms and make you feel worse. And there's great data on some of the trauma therapies that we talk about in the book, like EMDR. And this triggered my thinking because I see Jill Auerbach asking about exercise and meditation and yoga and other things to calm the body and calm the mind and the nervous system. I think these are really important things that we can all agree on that can be very, very helpful in making us feel better.
Yeah, not every remedy comes in a pill. People think that doctors should just, provide them with more pill. I think we should be providing multimodal strategies to get people better. I also want to say that we're so pleased that the book has been so widely endorsed by mainstream medicine, to have Sanjay Gupta endorse our book, and to have George Church, the father of the human genome, professor of genetics at Harvard, and other people like Mike Van Elseger from Harvard, and Dr. Herman, a noted professor down from New York City, from Cornell, Weil. I mean, it goes on and on. David Perlmutter, famous author. I think it's rare to have a book that really kind of breaks through the ceiling and has, these are controversial topics. And yet when we've sent this book out to very mainstream individuals who are really trustworthy folks and smart people in the industry, they've seen the value of it. And I think that was what kept motivating us on, that this is something we have to get out there and forward this message. So.
Absolutely. I have a few quick things to mention before we sign off, which is I mentioned our Facebook page, and Karen told me you got to tell them what it is. It's facebook.com/thechronicbook. Our website is thechronicbook.com. We have a COVID chapter that we added that is already, it's in the Audible version, it's in the Kindle and ebook version, and it will be in the next printing here. But if you got the hard copy and you want to read the COVID chapter, go to thechronicbook.com, and it's there waiting for you. It's free, of course, because you bought the book, and it should have been part of this printing, but this was printed right before we wrote the chapter. We did not expect a pandemic in the midst of the already global pandemic of Lyme and autoimmunity and psychiatric disease to hit us a second time. It's been crazy. You can find us both on Twitter. Twitter at my name, Dana Parish, with one R, Stephen Phillips, MD, Phillips, MD.
At Steve Phillips, MD.
At Steve Phillips, okay. And isn't it MD after your name or no?
At Steve Phillips, MD. They just didn't have room for the N.
Okay. At Steve Phillips, MD, at Dana Parish. We're on Instagram, and we also
Instagram is the Chronic Book, I believe.
The Chronic Book. Yep. And I want to thank Karen Guardian. She's been such a champion for us. She is the founder of Lyme Connection. She's been a dear friend of yours for many years, and I've been lucky enough to know her through you for the last 5 years. She's been a terrific friend and to this whole community. We're so grateful for everything that you do. Thank you to Leslie and everybody at Ridgefield Library for hosting this for us and co-hosting this with Books on the Common, which is a wonderful bookstore. And you can get the book there. You can read along with our book club at Survivor Corps Book Club. We didn't even get to talk about that, and come back and ask us questions on our Facebook page.
So people should know what Survivor Corps is. Survivor Corps is the largest group in the country for people with long-term symptoms of COVID. And we were very honored to be their first selection for their Book of the Month Club.
Yes.
And so we'll be going on their Facebook soon to discuss questions about the book as well. And I'm so obsessive, I want to answer every question.
I
on
know.
the thing. Yeah.
We're going to get in trouble.
Yeah.
Now, take one more question.
Well, it's hard to know which to choose from. One more question.
Can I offer two quick questions to ask you, Steve, before we go? Because I think you can answer them quickly, and everybody will be happy to hear these answers.
Okay.
Quick one about microbiome and antibiotics, and then Hashimoto's related to infections. Those are the last two questions.
Okay. So the microbiome, we go over this extensively in the book, and people think of the microbiome in very simplistic ways. And they think that the bacteria are just going to be friendly bacteria, and that's all there is. We call them, they're really pathobionts, which is a hybrid term between things that cause disease, like pathology, and symbionts, which are nice and friendly, because these bacteria can behave differently under different circumstances. And people think that, well, the antibiotics are going to wreck the microbiome, which can happen. Antibiotics are not good for the microbiome in general. However, people don't realize that when the immune system is disordered, which happens from these chronic infections, the microbiome also gets wrecked. There's a feedback loop that goes back, it goes around and around in a circle. And the immune system has to do this very delicate dance of stopping our friendly bacteria from becoming unfriendly and overreaching, overusing our resources and invading through our intestines. Most of our immune system's resources are focused in our GI tract. So there's this really very close communication between the microbiome and our immune system. And the immune system keeps it at bay in a certain length, arm's length away, then they get the beneficial aspects of the microbiome. And when the immune system gets messed up, which some of these infections can do, then the microbiome gets out of whack even before people touch an antibiotic. And then when people get treated for these chronic infections, what is the strategy to keep the microbiome in check? And we go over that in the book. In my practice, when I was out for 2 years, I was flat on my back reading for 2 years. And I came up with strategies to protect the microbiome. Before I was on disability, before I had my own illness, we had a very different story. I was using antibiotics in a more indiscriminate way. And you live and you learn, you practice and you learn. I think the doctors that don't change how they practice are not the ones you really want to go to. But so we have strategies for that. In terms of Hashimoto's, it's a common autoimmune condition. And is there a link to underlying infections? I can tell you that I've had umpteen patients with Hashimoto's where it's known that, when you treat them with antimicrobials, their antibodies against their thyroid go down. So I've seen that too many times to count. You say, what's been published in literature? Relatively little, but there was a study of chronic illness after tick bites in a French population of, Lyme and other infections. And these people were disabled, and they found a very surprisingly high rate of thyroid disease in that population. So it's hard to say because Hashimoto's and other autoimmune thyroid diseases are just so common in healthy people. I wouldn't pin it all on a bad infection, but it's something that I see in my patients, and it's something that I see resolve materially, but usually not totally with antibiotics.
Okay.
Wonderful. Thank you both so much for sharing everything, and your book and your determination and your compassion. We are so lucky to have you fighting for us. And thank you everyone for joining us tonight.
Thank you, everybody.
And the best of luck to you.
Thank you.
Okay.
Bye-bye.
Bye.
Bye.